Dr. Richter, even after the plant is closed down, storage of the radioactive material will pose a continuing danger for many years. An accident there could cause a meltdown comparable to Chernobyl. How would the medical system here in Vermont respond to that?
Well, I don't think any medical system in the country, we would really have to call in recruits from everywhere in the nation to handle something of that scale. We know from 3 Mile Island, we know from like Chernobyl, we have experience as far as that goes. And it isn't even just the immediate effects, it's sort of the long-term effects of a meltdown and what that would, the kind of effect that would have on the health of the population. As Peter said, particularly the young, and the increased rates of cancer and reproductive problems and bone cancer, thyroid cancers, all those things, leukemia, all those things would be increased. And could the medical care system handle that? I would say over time, I doubt it. That would certainly, we would not have the resources to be able to handle that. We'd have to do the best we can, but we certainly would have to import people from elsewhere to handle something on that scale, just in terms of the number of ICU beds and emergency room staff and that sort of thing.
A couple of months ago, I went to a meeting in Winooski where there was a nuclear engineer, and I asked him, well, if on one of these concrete storage containers, if an airplane crashed into it, what would happen? And he said that the radiation would reach down to Springfield, Massachusetts, maybe up to Killington and Rutland, and those areas would be unlivable for 100,000 years. He didn't tell us what would happen to the people that live there. I guess some of them would survive for a while.
Right. I mean, it depends on how close you are to it. Some people die immediately, some people die within days, some in months. But the amount, again, there's a rate of cell death, and then eventually, so people who are right in the immediate area, they usually die pretty quickly. And so it really would depend on how far away you were from it. There's no doubt about it. This would cause a calamity for our healthcare system and for the population. There's no two ways about it. And the fact that if we are relying on an aging nuclear facility that is unsafe and we have been lied to about it, this should be cause for concern for Vermonters.
Peter has promised to give us broadband internet service by 2013. This is very interesting for me since I started out as a computer engineer before going to law school. And I don't have internet service at home here in Burlington now. Is statewide broadband internet service important to the medical community?
Absolutely. I mean, what we're talking about now is trying to adopt electronic medical records statewide. I mean, that is something this Governor Douglas has been bragging about, that we're going to have this, I think he said by 2012, electronic records for the entire. There are days where in my health facility where, first of all, I can't even get cell phone service. So if somebody happens to call the cell phone in Cambridge, I can't even get it. But when you consider this, the reliability of what exists right now, there's no way we could sustain electronic records throughout the entire state without that. We're going to need that. It's absolutely essential. I mean, people still doing dial-up. It's ridiculous. I think we're actually 50th in the nation in terms of access to broadband at this point. We were 46th several years ago. We're now 50th. That's pretty pathetic.
And my friends in Europe tell me that it's much easier there than it is here too.
Yes. I mean, when you look at like in the subway in Japan, you can get it. You can get a signal. I mean, there's things. There's so many things that we are behind in this country because we don't consider certain things like that a public good. Again, it goes back to healthcare. I mean, this is something that in many other countries it's considered a public good, like your road system and whatever. In ours, it's a source of competition and profit, and there's certain things that really should be something that we consider a public good.
We talked about the wars in Iraq and Afghanistan. They've lasted longer than World War II now, and they've claimed the lives of thousands of young Americans, including members of the Vermont State Militia. Some of our young men have come back wounded with PTSD. Have you encountered any of them in your practice? Are they adequately cared for in the Veterans Administration? Will they benefit from single-payer health care?
Well, the thing is, as I said before, in terms of single-payer health care, what we have then is you're able to give, you allocate your resources. And I know the Veterans Administration has been trying to do that, and again, it's been a tough thing because of the number of people that are suffering from that. I have a few people in my practice that are suffering from that. And fortunately, we have good services in Vermont. We have, but we don't have enough of them, and I think that's really something that we need to allocate more resources where there is need, and less resources where it's a waste. And again, that gets back to not wasting money on unnecessary paperwork. I do not think that nationwide we have enough of those services available, and in Vermont we're doing okay, but we're still not. There aren't enough psychiatric services in Vermont in general. We're very much in need of that, and nationwide. So certainly this is one of the other issues that goes along with that.
So we get a double whammy from the war. We contribute $1.5 billion to pay for it, and then our young people come back with these injuries and are a burden on our medical system.
Right. And oftentimes just don't even have their families don't even have the health care insurance. There are many veterans in this country that are uninsured. So that is really, to me, just another horrendous thing that we do. We send people to war, they come back and then aren't even guaranteed that they are going to have their health care paid for.
That's an important point that we should bring out. Many people think that the Veterans Administration, they take care of everything.
And they don't.
Right.
They don't. And especially those in the reserves. I mean, they're not guaranteed that they will actually have health insurance, and many of them don't. So this is also something, you come back with an injury and then you don't even have the insurance to cover you for taking care of that injury.
Many veterans experienced that during the Vietnam War. There was Agent Orange. Mm-hmm. Did you encounter any of those victims?
I did not. I wasn't working at the VA when I was in Buffalo. I did deal with many people with PTSD at the time, but certainly not with Agent Orange.
I remember that was my generation that went to Vietnam, and I remember that for a while the government wouldn't even recognize it as a problem.
Right. That was before my days in medical school. So.